Introducing Budweiser Zero. 0% alcohol, 0 grams of sugar, full Budweiser flavor. For all the moments you want a beer and need to stay on your game. Budweiser Zero. Zero compromise.
Next to last day in April, and it's warm and sunny in southern Ohio. How cool is that?
It's a beautiful day.
Mr. Secretary, thank you. And thanks all for your patience and waiting. We know we're a couple of minutes late. When the announcement came that this center could very well close, the announcement in mid-March, this is my third trip to Chillicothe since then. Senator Portman has been engaged. This is not a partisan issue in any way. I met first with union members who work at this hospital, 1,400 employees here. Was 1,700 at one point, but 1,400 employees that matter in this community. Then I met the next time with veterans in the area from a multi-county area from probably 6 or 7 different counties. Each of them asked me to request that the Secretary come in and visit Chillicothe and see what's happening in this community. The Secretary has been very, very cooperative in private conversations and in the Veterans Committee, which I've served on since I came to the Senate 15 years ago, and by coming here today. And this has been dropped in his lap. He has inherited this. But as I said, there is no partisan flavor to this. Both Rob and I are working to keep this hospital open. We saw in the meeting we just came out of with a number of management, with the entire management team, with Director Berger and the whole team, that they are carrying on this mission here. They know how important this mission is, regardless of what's happening in Washington, regardless of what's happening with the Air Commission. So that will continue, and understand all of you in this community, some of you in Columbus, some of you from Columbus to Portsmouth over to Ironton to all over this area, understand the important, we are, every meeting we have been in and will continue to be in today will show the importance of this to the community. And a small example, but not a small example, there's a fire department in the Chillicothe VA. That fire department serves much of Ross County, and Ross County would be in a world of hurt if this fire department weren't here. I mean, that's minor compared perhaps to the thousands of veterans, more and more women veterans coming in, more and more mental health. In this center, this Chillicothe Hospital may be the most important mental health hospital in the VA system in this region. They are particularly outstanding there, and we know the challenges that continue there. So thank you. I'll turn it over to Senator Portman, who earlier pointed out the history of this institution, of everything else great about this hospital. The history is some of the richest in the whole state, and Rob was talking about that earlier, but Rob,
yeah. Well, first of all, thanks to Secretary McDonough for coming out. We wanted him to see the facility, and most importantly, to see the people, the veterans, and the incredible workforce out here led by Dr. Kathy Berger that provide extraordinary care to our veterans. And they deserve the best. But we can see again with what's happening overseas that we live in a dangerous world, and we rely on our veterans to keep the peace, to protect our freedoms. And when they come home, we've got to provide them at least the health care they deserve. And increasingly here, it's mental health as well. So I'm really delighted that you're here, Mr. Secretary. I look forward to hearing from you. I will say that as we did our town hall meetings all around Southeast Ohio, our staff went to 8 different counties. And as I talked to veterans throughout Southeast Ohio, including recently, veterans calling our office, as you can imagine, very concerned about the possible closure through what's called the Air Commission process. You hear the same thing, which is that the care that they're getting here at Chillicothe is really special. I've represented Ohio for a while, as has Senator Brown, and we hear from veterans a lot on different issues related to our VA facilities in Cincinnati or Dayton or Cleveland or Columbus. And it's usually pretty good. But with regard to Chillicothe, it has always been good. People feel like this is a place where they are welcomed and treated with dignity, and that's what they deserve. This is home. So it's a real problem if this were to shut down, because people are already driving an hour, sometimes as much as 2 hours to get here. To add another 90 minutes to go to Dayton or another hour to go to Columbus, wherever, it's just the wrong thing to do for our veterans who do live in this part of the state that has provided so many men and women who have been willing to put their lives on the line for all of us. And this is a heavy rural area. So when we drove in today, there was a gentleman standing with a sign, and the sign said, "I'm clean and sober, thanks to this VA." And that's one thing that they've done a good job dealing with, is the substance abuse issues that unfortunately fit this part of our state hard, the mental health issues as we talked about. So our hope is that this visit today will just reinforce the feeling that I hope all of us have, which is that people here are doing a great job and that the veterans deserve the incredible care that they get here. And again, Mr. Secretary, thank you for coming out personally to see this. Secretary McDonough.
Thank you very much, Senator Portman and Senator Brown. Thank you for inviting me to Chillicothe. Thank you for arranging for a spring day here at the end of April. As a Minnesotan, this strikes me as just about right. So thank you very much for the opportunity to be here. I want to just say to Kathy Berger and to her team here how proud I am of your great work. We just saw in our coin award ceremony inside, where we highlighted the high performance of 5 particular employees here at Chillicothe, the great work that's carried out every day. And I could not be prouder of this team, and I could not be prouder of the way they have done it throughout the pandemic. Oftentimes putting themselves and as a result their families at risk to take care of veterans. And I am honored to be associated with them, and I'm thrilled to be able to see their work up close and personally today. I think it's also very important to underscore that the Air Commission process as envisioned by Congress in 2018 is a goal to try to ensure that VA remains in every market in the country. And that's what President Biden will demand, and that's what these 2 senators, of course, are continuing to press upon. And under no circumstance will VA leave Chillicothe. VA is committed to our veterans in every market of the country, and that's definitely true here in Chillicothe. I'm here to listen to not only the remarkable workforce and to our 2 senators, to your 2 senators, but also to our veterans and to our union employees about their concerns, which I've been obviously watching very closely, and their ideas. And so I look very much forward to that for the rest of today. It's off to a great start, and I look forward to hearing your questions. So with that, we'll over to you.
Mr. Secretary, is it my understanding that with the Air Commission, it's an all or nothing in relation to all of the recommendations nationwide?
Yeah, so the statute itself was agreed in 2018, signed by President Trump then. The idea will be that the recommendations that were published in the middle of March will go to the Commission. The Commission then will either ask those to be changed and thus send them back to VA, or forward them on to the President, at which point the President will either ask them to be changed, terminate the process, or forward it on to the Senate, House and Senate. If the President forwards it on to the House or Senate, the House and Senate have one option: either approve it in total or disapprove it in total. They can't take out individual pieces of it. The whole process at the moment is stopped because the Commission itself is not yet appointed. Unclear to me when that gets done, but that's how this situation is meant to unfold. Let me just underscore one thing. This is a process focused on the physical infrastructure of VA. At the same time, we are aggressively implementing a human infrastructure project at VA, because at the end of the day, the most important thing about VA care are the professionals like Kathy and the care that they carry out. And thanks to the 2 senators and to the President and to the House, we now have in the RAISE Act a very important set of authorities to allow us to increase pay for nurses. Something vitally important, we just heard from Katie, our head nurse here, something vitally important to nurses in this market. Meaning, while this process carries out, what will happen there will happen. What will not happen is us losing attention on our veterans and ensuring that we maintain this world-class healthcare.
So you say that healthcare is not going to leave the Chillicothe area. Does that mean there will not be a reduction in services such as the CBOC clinics, or is things going to stay status quo when you say it will not leave the area?
The recommendation that was forwarded to the Commission and published in the Federal Register in the middle of March anticipates the building of a new, what we call multi-specialty CBOC, or community-based outpatient care, here in Chillicothe. So it envisions a new facility that has a range of services that is basically a reflection of where healthcare in the rest of the country is headed, meaning towards more outpatient care rather than inpatient care. The difference is what is outpatient today is not what was outpatient even 10 years ago. Outpatient specialty services include surgical services. Outpatient services include obviously primary health and mental health care. So in all cases, we will stay here maintaining the fundamental integrated health care that the VA provides, drawing on a network of capabilities. That includes private sector providers, CBOCs, and our relationships with other Ohio providers.
Let me go back to the first question for one moment and thank the Secretary for explaining that whole process so very thoroughly and very well. You can see from that process that the Air Commission, once it is or if it's up and running, will receive information about each community. And Beth Clodfelder and my office, Michael Dussman and Rob's, have been sometimes together, sometimes separate, have been in virtually every county in the service area. That's why we wanted that's why I invited the Secretary in today, so he can hear about how crucial these services are. And as the Air Commission, if the process goes forward, can be fed that information. Because the data they've looked at is really, because it began in 2018, most of it was pre-pandemic data. And we just don't have enough, they don't have enough information upon which they based the report that was handed to the incoming Secretary that he really had little to do with. So we want to make sure that he's equipped, that the VA's equipped, and that ultimately the Air Commission has the information about how crucial this is to this community, to these veterans, as Rob said, that have to drive so much farther, and particularly if they're have certain illnesses, mental health and physical health illnesses, those drives will just be excruciatingly difficult, and some won't make them.
Yeah, let me just, again, we're so glad the Secretary's here, and I think he's had a good visit, and as he said, he's impressed with what he sees. But we don't like the recommendation, okay? And speaking for myself, to set up a new facility outside of this campus makes no sense to me. We have this incredible campus here, that dates back to the days of Fort Sherman and World War I recruitment, and since then has provided a century of incredible care. So we, to answer your question more directly, perhaps, yeah, it would require a loss of jobs here if the recommendation were accepted. And we think there are some interesting opportunities. Again, Secretary, I think, was very impressed with what he heard today, because there is, as an example, a growing mental health issue here, and maybe some new ways to treat mental health that are more creative, more innovative in terms of some mid-level care, longer-term residential care, other things that this facility could be very well equipped for. So that's the discussion that needs to take place, in my view, is that how do we change that recommendation should the process go forward? Again, the Commission has not been formed yet, but once it is formed, my concern is it could act pretty quickly, and then you could have an up or down vote in Congress, which could be difficult to stop. So I think, again, this visit is very important. So is our ongoing dialogue that Senator Brown and I are having with veterans all over the community and with the folks here at Chillicothe VA as to what the real needs are and what could the future mission be that would keep jobs here and, importantly, keep a place where veterans in our rural area feel at home and feel like they're treated with respect.
So, Mr. Secretary, I was with the President last week. I asked him about this issue. He didn't seem to know much about it. So is he in the Oval Office even briefed on what's going on here in Chillicothe?
Yeah, remember, these recommendations are not the President's recommendations. These are the recommendations that VA has made to the Commission. The Commission has yet, as Senator Portman just said, has not yet even been formed. They will then make some determinations, and then they'll go to the President. And so it doesn't surprise me that the President didn't have a reaction to you about it, because has not come to him yet. I will say this about the President. He's just submitted the largest budget request for VA in its history, including important investments in mental health, substance use disorder treatment, women's health, and importantly, as we look at a facility like this, as storied as it is 100 years old. And so it does have updating needs. And so that's why the President has both asked Congress in the context of his agenda to dramatically increase investment in VA infrastructure. And I know that's why Senator Portman and Senator Brown have been so supportive of infrastructure spending. And that's why his budget this year has the largest ever request for VA infrastructure.